We're up. Happy lunchtime, everyone. Thank you for joining us for Including All Kids Project Data Team for our discussion on what we've learned over the past year from surveying parents and caregivers around West Virginia about their experiences with the healthcare system when accessing it for their children with developmental disabilities. I'm Kelly Caseman, the Executive Director of Think Kids, and those of you watching on the YouTube channel are welcome to share your questions and comments in the comments section, and we'll get to them as the conversation progresses. So let me take a moment and introduce our panelists, the data team in alphabetical order. I don't see Elliana on with us yet, so I'll introduce her when she comes. Sara Berzingi is a West Virginia University medical student and with the Student Advocates Impacting Decisions on Healthcare. Thanks for joining us, Sara.
Thanks for having me, Kelly.
Amanda White, who is with the Health Plan. Hi, Amanda.
Hello.
And Shawna White, who is with Disability Rights of West Virginia.
Hello, everybody.
Thanks so much for joining us today. Let's talk a little bit about the project itself. So I'm going to pull up the web page. I am, just a second. There it is. Okay. So, can everyone see the web page?
Yes.
Great, thank you. The Including All Kids project is in its second year. It's funded by the West Virginia Developmental Disabilities Council, and it's managed by Think Kids. The project's goal is to help improve the healthcare system for kids with developmental disabilities by understanding, giving voice to, and amplifying the challenges families face when accessing healthcare. Panelists, what interested you in serving on the data team?
I know what really sparked my interest was the series of cases that I noticed a trend in. We kept getting calls about children not being able to access, healthcare for different reasons. As an attorney and advocate, I was wondering, what is causing this? Because it wasn't your typical problems. It wasn't always something you would think of right away. They weren't accessing healthcare because the healthcare staff didn't know how to deal with their particular disability or considered them problematic because of behaviors that they would have associated with their disability. We also saw lack of transportation and lack of specialists. And so I thought this was a wonderful opportunity to take a deeper dive into why we kept seeing this issue pop up time and time again.
I agree with Shawna. I thought that, personally as a medical student, and then also from a more personal perspective, I have a brother who has autism and is nonverbal. So from both of those fronts, I had kind of a vested interest in this topic already. But going into the medical field, I would say I've noticed more than a few episodes where I have noted providers that I'm supposed to be learning from who don't necessarily know how best to work with kiddos with developmental disabilities, even adults with developmental disabilities. And when I saw this project was going on, I thought it was a great opportunity to kind of learn more about how everybody else in the state was also experiencing and whether or not they also had noticed some of the trends that I had experienced with my own family trying to get services for my brother, and whether or not we could make a real change to our healthcare system with the data that we find from these surveys.
I think for myself, it was definitely more of a personal level, just because I had an aunt who had a developmental disability, and just learning through working with her in my family after my grandmother passed away, and just my own personal experience in my working career. I had over 15 years in the mental health field. And so I advocated on behalf of a lot of clients. And I know that that was a struggle, even in the Northern Panhandle, where we have a lot more services than a lot of other areas in the state. So that is where my passion came from specifically for this project.
Thanks. I'm certainly glad you all did join the data team. We had a lot of work to do once we started, because I think one of our first questions was, where do we start, right? What's a priority? What questions should we ask? So would you all like to share a little bit about the project or in the process? How did we develop questions for consideration? I'm going to share a couple of screenshots as well while you're talking.
I think
sorry. I think the process really went well and smoothly because we had all the different opinions on our team. Having, somebody who's in the medical field, having somebody who has experience with advocacy and attorneys, somebody who has experience with outreach and insurance issues, it all led to us being able to pull together our experience. Sorry. I think the process really went well and smoothly.
Okay, I think whatever happened is over. If you want to continue, Shawna.
Okay, yeah, what I was saying, and I don't know how much got on there and how much was an echo, but I said I think the process basically allowed all of us to reach back into our experiences that we've had during our careers and pull examples from that of issues that we knew existed already, and then place that into the question. So it was a huge benefit to have so many different people that were so dramatically different in their experiences and background.
Agree. Sara and Amanda, do you have anything you want to share?
I think Shawna really hit on the highlights. We all kind of came together and shared some of our stories and experiences that we had seen, whether in our own personal lives or in our careers. And from that, identified an insane number of topics that we wanted to cover. From that, I think we were able to kind of identify some key categories and try to see where those categories would fit in as far as creating surveys for each one. Now, we recognize that we were not going to be able to hit everything, but we wanted to ensure that we were touching on the things that were most pertinent to the families and the caregivers with regard to their experiences in the healthcare system. So I see you kind of pulled up what we were looking at. So some of the big themes that we saw in our questions were that people were having trouble with insurance, with navigating the healthcare system, with travel, with the perceptions of their physicians or providers in whether or not they could take care or were trained to take care of kiddos with developmental disabilities, and then schools. And kind of from there, we wanted to see what we could best tailor into surveys, because we wanted to make sure that if we were creating surveys, they were going to be surveys that people were going to be able to actually finish. We didn't want to inundate people with too many questions or too much all in one survey.
Thanks, Sara. For a pull it down, Amanda, you have anything you want to share?
No, they said exactly what I wanted to say. I think that this process went really, really well. I think that we had a great team, and sometimes when you're trying to develop questions and work with a team to develop surveys, it becomes very cumbersome. And that process, I don't think that we had that. We had a lot of information that we wanted to find out, but we were able to pare that down to questions that were broad enough that would help us answer everything that we did want to know. So I think we meshed well together.
I agree. I found the task at first very daunting, but I felt like we came up with a lot of information and were like-minded in what to prioritize. And so we have completed 3 surveys, but we actually have enough questions for 7 surveys. And hopefully we can get some momentum going and get more responses for the other ones that we plan to disseminate later on. And I'll get to the first survey. Elliana, would you like to introduce yourself?
Yes, hi, sorry, technological difficulties earlier, but my name's Elliana and I am going into my senior year at West Virginia University as a public health major. And in the past, I've worked at Ruby Memorial in the hospital systems ever since my freshman year of college. And I have witnessed so many individuals with healthcare disparities in the state of West Virginia, but specifically children. And that is just catalyst what I want to do with my future. I am just super interested in working on projects like this in order to help create as much healthcare change as we can for the residents of West Virginia, specifically its children.
So Eliana, you're looking at becoming a navigator, correct?
Yes.
Yes. So I think that we can give her a lot of helpful information as she goes forward with her professional career. Let's take a look at the first survey that we shared. This is, I'm sure, hopefully that's survey 1. And let's take a look at some of the questions that we asked. So again, these questions were specific for parents and caregivers of children with developmental disabilities. So first we wanted to ask what county in West Virginia do you live in? And I hope after we do more surveying and we really take a look at our responses that we can look at the differences in counties, because it seems to me as if the healthcare experience can be so different depending on where you live in the state. And so I hope that's something we can circle back to. We asked, how do you rate the amount of quality of assistance you receive from the healthcare system to navigate it? For example, have you received help connecting with a referred provider for specialty care? Did someone sit down with you to explain a diagnosis? Have you received information to connect with a support group? And we'll get to some of these responses in a minute. Have you ever had a doctor refuse to provide care for your child? If so, why? And we asked that question because due to initial conversations we were having, I really didn't think that would happen as often as it did, but apparently it's an unfortunate situation that some families go through. Number 4, have you ever had other kind of healthcare providers, counselors, or pharmacists refuse to provide care for your child? If so, why? Have you ever been waitlisted to receive healthcare services? If so, what services and how long? As your child has aged, have you experienced a decrease in available services and supports or access to healthcare? If yes, at about what age did you begin to notice a decrease? Do you ever have difficulty in keeping your child's medical records intact? That was another thing that came up during initial conversations. If your child has multiple healthcare providers, do you personally have to share information between them, or are there records connected electronically? Have you ever received help from from healthcare employees identified as care coordinators or service coordinators? And then we asked some open-ended questions. What are the biggest barriers to accessing healthcare for your child that you've experienced? Do you have any additional information you'd like to share about your experiences? Do you have any recommendations on how to improve the health care system for your children and families with developmental disabilities? And so anybody want to share any thoughts before I start sharing the results from our website? There's some pretty, looking back, there was some pretty in-depth questions, wasn't it? So we did from that survey, we received 100 respondents. We usually will close it once we receive 100 responses. I mean, you see, we received a variety of responses from folks around the state. So 32 different counties represented. Let me pull this so it's a little easier to read. Is that easier to read, folks? I'm not sure what it looks like on your end. How would you rate the amount of quality of assistance you received from the healthcare system to navigate it? So you see, most folks said the help I've received has been average. It was 30%, 27% said I've received little to no assistance. 21 said I've received helpful assistance from providers' offices and support services. And then 14 said I've received some, and 7% have said I've never received assistance. Did these responses surprise anyone? Or did you think that's what?
I was not particularly surprised, especially, I know a lot of people were surprised that people had not received assistance, but I have found that a lot of times people call us for answers to those questions and for that type of help. And while we don't typically provide those services, we do provide information and referral to a lot, and we're very good at that. And what I found in working those cases is the lack of training with hospital staff. A lot of times staff there's high turnover. They might be responsible for multiple different jobs. They, maybe they're trying their best, but they haven't been given the proper foundation, or they're overworked, and they just don't have the information to share with the clients, or that's not part of their dictated role in the healthcare facility. I think, one of the best ways to solve a lot of the problems we have here is, increased staffing and better training.
Right. That kind of segues into the next question. Have you ever had a doctor refuse to provide care for your child? And 18% said yes, they weren't trained or experienced. And then 13% said yes, they didn't accept my health insurance. And so in those, especially rural parts of the state, if a provider refuses to see your child, you could be really hard pressed to find someone, if transportation is a challenge for you, that becomes a real burden.
And that's only really half the problem. What we found, I think, in our research and studying, and what I brought to the table as part of my experiences, sometimes the doctors don't say, no, I'm not prepared for this, and they're not prepared for it. And then some really bad outcomes, traumatic outcomes, or medically, negative outcomes can transpire because of that lack of training and preparation to know how to really interact with individuals with developmental disabilities.
Yeah, we'll get to some of those responses when we get to the write-in answers. Next question, have you ever had another kind of healthcare provider refuse to provide care? That was just 15% said they didn't accept health insurance. 10% said they weren't trained or experienced in providing needed care. And I think we can drill down into that a little bit as well to see what kind of provider they're talking about. Have you ever been waitlisted? I was surprised to see 42% say no, that they've never been waitlisted. That's been a continuing problem in our state. Of course, we see 18% say yes, we've been waitlisted for mental health care services, which of course is an ongoing problem in the state. Next question, as your child has aged, have you experienced a decrease in available services and supports? Yes, but from 55%. I think that's something else I hope we can drill down into as the project progresses. So we can look more along the line of services, because we know that there are a number that are available when a child's very young. And we know that there are some school aged, but then we know that there are also real gaps. We need to articulate where those gaps are. Do you have difficulty keeping your child's medical records intact? The highest percentage rate response was sometimes I have to share information between different doctors and providers. 27% said yes, records are shared between providers. And 20% said unless providers are connected to the same health system, I have to bring copies. And that came up during our roundtable discussion last year, that, if you're with seeing providers with WVU Medicine, for example, they share electronic health records. And so your primary care provider may be able to share information with your specialty care provider. But especially if you're going out of state into a different healthcare system, then you may have to take all of your copies of all your medical records. And we had a couple of parents, you may remember, with big binders of all the information to make sure that the provider had the information they need. Have you ever received help from healthcare employees identified as care coordinators? 49% said yes, which was surprising and positive. And then we have a number of, we did word clouds with the biggest barrier. And so we know that what Medicaid covers and doesn't cover, especially, is a continuing challenge. Lack of specialists, lack of providers. And then, do you have any additional information you'd like to share about your experiences? And you can click on the website to get some more of those responses. Before I get into the written responses, is there anything that stood out to you all that you want to share in those responses we just discussed?
I think the wait list was really an interesting question, and one that I was most curious about, because I had seen on one of my rotations of patients and their family come in, and they were out of the cutoff of birth to 3, which I think is something that we get comments on in a couple of our surveys, that once you've kind of aged out of that embedded system, it becomes really hard to get services at home. But the problem is that sometimes if you're waitlisted until somebody reaches a certain age, then you don't get that access to care before that time. And I think that becomes a really significant problem that we see for so many in our state, especially with difficulties with access, difficulties with transportation, difficulties with lack of providers. And I think that ends up being one of the most commented on thing, or the thing that I noticed the most in all of our comments and across all 3 of our surveys, is the lack of providers. And I think those all just kind of tie in together.
Agree.
And my eye was even drawn when looking at all these results to that final word cloud, that last one that you just showed. And all those words are different words that people reported. But if you even look where it says like treated better, I think that is like something that really stuck with me, that like those 2 words aren't necessarily like someone didn't say those together, but the fact that they were even put right there next to each other just kind of proves to me and like hones in on the fact that like that's the goal. Like that's what we need to accomplish for these people, is that we need to be treating individuals better with the healthcare that we have in this state, and we need to find ways to improve upon that for them.
That's a great point. And that's something that's come up in some of the other webinars that we've done, is that, the trajectory of kind of how these kids and families perceive the healthcare system really depended on the first diagnosis and how they were cared for. Or, so here's the diagnosis, here's the education you need, here are the resources. And so families, it could be kind of a devastating diagnosis, but then they felt as if they were in good hands as they moved forward. And what sometimes happens, and we see this in some of the comments, the write-in comments, is that people they feel like they're kind of grappling in the dark to try and find resources, figure out what that diagnosis means. And so that is a really cold experience for them that really taints the way they maneuver through healthcare as they move forward. And so I'm just going to skim quickly. Did any of these write-in comments stick in your minds, data team, that you want to discuss?
I think for me, the key, and you'll see that as you keep scrolling, is that most of the write-ins had to do with training, that there is a lack of training across the board. And I think that even if we look at a broader perspective of just helping patients that come in, whether that's to a doctor's office or an emergency room or to a counselor's office, is that everybody needs more trained, because they're not even aware of what their patient can get, maybe even within their own facility. Maybe they don't even know, what's 2 floors up from them that the patient could receive from them. So definitely more training, even for the doctors and for the nursing staff that are helping them, or the medical assistants, anybody within that office who could even answer a phone that maybe a patient's calling or a potential patient is calling, so that they have the answers to be able to help folks. Because sometimes you're just, we may grasp at straws trying to figure out how can we help ourselves or our family member or loved one. And we may call, 5 different facilities that we may not necessarily need. But if we're trained to know who in the area can help, then that could help alleviate some of that burden for those who are in this state that are struggling. And maybe even less people would move out of the state if they just have that additional assistance.
I agree. I was just thinking about what you said. You see so often, we need more providers, we need more specialty care. And it's something that we learned as this project unfolded, was sometimes the care could be there, but we don't know about it. And another thing that really stood out to me was more support for parents. So, if we had a better, more robust peer or family support network, so, You know, some of the most vocal, articulate advocates we have for kids with developmental disabilities in the state are mothers. And they are kind of doing it on their own. People figure out who they are and contact them. And so if we had a more organized and funded parent support group, I think that would be really meaningful. And then we'll stop with, I love to see early intervention expanded to age 4. So exactly what you were saying, Sara.
Yeah, there was another comment that I just thought was so right on the nail. It said, make it more simple for families that are already struggling. Don't make it more difficult. And I think that's, you know, a good summation of our system today is finding information is difficult for providers and for patients alike, and for patients' families and caregivers. And as you said, sometimes that information is there, sometimes the services are there, but just finding that information is so difficult. And so I think, you know, one of the things we talk about when we make surveys is what do we do with the information that we get? And after having seen so many people bring that up, it seems like, you know, the logical next step is to talk about, well, how do we create those systems? Who do we talk to create some kind of software or program or website or whatever to really centralize that information? And, you know, our goal is to find the information and find the problems, but the next step is really finding some of those solutions.
Well put. And an important point. Anybody have anything else on survey number 1 that they would like to share before we start looking at survey number 2? Okay, let's see if I can pull up the right one. Okay, here we, nope. Yeah, you're looking at survey number 2, I think. Does it say perceptions? Great. Yes. Okay, let's take a look at those questions and discuss the responses that we received. So perceptions is just that. We wanted to see how families perceive the healthcare system and how they felt they were being perceived when they utilized services. So the questions we asked were, do you believe that the healthcare system is responsive and supportive to the healthcare needs of children with developmental disabilities? Do you feel valued and supported by the healthcare system as a parent or caregiver of a child with developmental disabilities? Are you ever concerned that a physician or medical provider's negative perception about people with developmental disabilities contributes to a lack of access to care or the quality of that care? Have you ever stopped going to a doctor's office because of the way the doctor or staff treated you and your child? Do you think that local doctors have the proper training and medical knowledge to care for your child? Have medical staff ever misinterpreted your child's behavior as potentially dangerous because they weren't trained to care for those with developmental disabilities? What is the most challenging or frustrating misconception do you perceive healthcare professionals have when it comes to your child with developmental disabilities? And then again, please share any thoughts, perceptions you had in navigating, utilizing the healthcare services in the state. Do you have any recommendations on how to better address these misconceptions? And so I want to say that, you know, I've done surveys over the years, and I have never seen so many people fill in those boxes, the comment boxes, as much as we have with this project, which really led me to believe that, you know, parents and caregivers are really longing for people to listen to the challenges that they have and recommendations to improving the system. So I'm glad that we could give them that. And let's take a look at the results that we've received. So again, we had a pretty good mix of responses from around the state. Do you believe that the healthcare system is responsive and supportive? 24.51% said yes, 62.75% said no. So it seems as if that's a really pretty high number of people who had a negative perception of the healthcare system when it came to addressing their child's developmental disabilities. Do you feel valued and supportive? Fewer than 2% said always. Usually it was 28%, sometimes 40%, rarely 21%, never 6%. So the largest percentage was sometimes. Are you ever concerned that a physician or medical provider's negative perception about people with developmental disabilities sometimes was actually 43%, which struck me as rather high. The second highest was, well, it's a tie, as usually and rarely. Again, which is a rather high percentage of the negative or sometimes, so it could go either way, which again, I think it may depend on where you live and who your providers are. Have you ever stopped going to a doctor's office because of the way the doctor or staff treated your child? That is a 67.65%. So many 68% of families have stopped going to a doctor due to the way they were treated, which is, I think, really high. Do you think that local doctors have the proper training? That is, again, sometimes. The second highest is rarely at 29.41%. Have medical staff ever misinterpreted your child's behaviors? That was at 36%, no at 61%, which surprised me because we had been contacted by a couple of parents who said that they've had their child restrained, or they felt as if their child was simply misbehaving when the child was really just showing fear or, anxiety. So what is the most challenging or frustrating misconception do you perceive healthcare professionals have when it comes to your child? What I see is lack of understanding, which again goes back to professional development. Please share any thoughts or perceptions you have in navigating and utilizing healthcare services. Again, you see some of the same words. Child needs better access, insurance, and specialists. And then before we hop into some of the write-ins, is there anything that stuck out to you with these responses?
Well, one comment I'd like to make is I wasn't surprised by only 36% saying that, they didn't have that experience where behavior was there was misconceptions about that behavior. But I think the reason that it's only 36% is also why the ones that do happen are so severe and the medical profession doesn't pay attention to them. Because if you think about it, every child is different. And that was a comment I noticed too, that to me showed the need for training, which is telling somebody their child will have a normal life. Well, what's normal life? What's a normal child? Every child reacts differently. One child who's afraid of, say, a needle may cower under a table. One child who's afraid of a needle may sit there. One child may be nonverbal. So the only one that's really getting treated poorly is the one who's able to vocalize that fear and stand up and say, you're not going to do this to me. Also, younger children are not likely to stand up for themselves. Also, which I think is a need for more training, is a lot of people with disabilities have felt like a burden their whole life. So even by 14, 15, 60, they're trying to be as small as possible and fight as little as possible. And that doesn't mean that traumatic experiences aren't happening to them. It just means that they aren't going to verbalize it or act in a way. So the people who are able to say, I don't want you to do that, I don't like this, or I'm scared, are the ones that are seen as being problematic because there's so many other people who try to, not voice their concerns or are unable to. Great. And the need for training, I think, is a huge point that we all need to take out. And I can't point to one because there's so many of them. I mean, we know doctors need medical training, but they also need training on how to just deal with an individual. And I think from our experiences, we know that in the pediatrics field, that training is getting a little better for new doctors, but there's nothing out there for existing doctors or doctors who also encounter children with disabilities like ERs or urgent care or specialists.
Great point.
Yeah, I fully agree. I think the question that really stuck out the most to me was asking if local doctors have the proper training and medical knowledge to care, and overwhelmingly 61% said no. Now, having almost completed my medical school training, I can say that, and I feel a little bad about saying this, but the reality is that, we aren't I mean, that's the honest to God truth, is we are not getting that kind of specialized training and working with kiddos or even any kind of folks, adults with developmental disabilities. I can think of one short PowerPoint unit that maybe covered it, and that's not enough. That's, it's an indictment of our system that we're allowing people to complete their training without ever actually getting any kind of focused training or preparation for this type of role. And I think that, as Shawna mentioned, we can start by helping the next generation of doctors get that kind of training, but we also have to ensure that those who are already out in the field are also getting that kind of training, are also getting access to those resources. And the very first thing that we have to do is make sure that everybody knows that it is a problem, and that, everyone around the state is putting in the comments that there needs to be more training. I mean, that would not be the case if everybody was properly trained, right? So clearly it is an issue, and it's one that, it's time to start working on.
And I think it is an issue too of that being made available by the right parties. And because what I can say about that is a lot of people have been shocked to find out, and that we at Disability Rights of West Virginia have been contacted by doctors themselves saying, please help me learn. I want better outcomes for my clients. And that, I think, shows the need for training needs to be available to the doctors. And the older doctors are the ones training our young doctors. So if we only teach it in medical school, that will not be reinforced out in the field. We need to start holding hospitals accountable for those trainings. We need to start holding licensing boards accountable for those trainings.
I fully agree.
And I think of this question also from the perspective of not just doctors, like nurses, ancillary staff, anyone that's going to come into contact with these kids, or anyone that is atypical or just is a little bit different from the normal training that a doctor or nurse, or like I'm a clinical associate at the hospital, like a nurse's aide. And we're not taught to do any of this. I spent 3 years in nursing school before I switched to public health, when I found this is my passion. And I never once was trained to look at a child's diagnosis and think, okay, how is my behavior affecting them? Like, what can I do differently? What can I say differently? How can I make the environment different so that they're the most comfortable to create the best environment for them to receive care? And it's just crazy to see, like, it's not just from the doctors. It comes, like, it trickles down the hierarchy of healthcare too, where there needs to be better training.
That's a very good point, because a lot of problems that we see coming into contact with in our office, the trauma, the injuries, the negative medical outcomes have already started before the doctor enters the room.
Mm-hmm.
So, and it's not like there isn't answers to these problems. They're out there, and there are a lot of hospitals doing things like having specially trained staff who are the first person to meet with the family and the child to learn about, okay, what do I need to do to make this work best for us and you both at the same time? And what that always kind of confused me too is, why do employers, why do licensing boards, why do medical schools want their doctors and nurses to be in the line of fire when they don't know how to act appropriately? So I think it's also an employee issue. Like you said, you don't know what to do. And if you were trained to do what you needed to do, you would be happier professionally.
Yeah, and I've experienced in the hospital, so we have something called like a patient safety program, where if a patient is confused or agitated or like a harm to themselves, or just need more like one-on-one care, someone that's like a clinical associate like me will be in their room 24/7. And I grew up, my mom's an occupational therapist. I grew up working with her in her office my entire life. And I've had people that are my staff, like same level as me, be like, hey, will you take this patient safety sit to the peds floor, because I'm just not comfortable. Like, that's just not something that I know enough to do. And I obviously will always do it because I'm very comfortable with that. But that's that's just shows a breakdown in the education, that's even something that is happening very commonly.
I think one other thing is exactly like you mentioned. Sometimes we do defer to peds, and while we are talking about kids, I've even seen a number of times on the adult floor where they will ask to transfer them to their pediatrician, their developmental pediatrician who had been seeing them, because they are less familiar with some of the genetic conditions, some of the developmental disabilities that start in childhood, because they don't really see it as often in adults. And while, yes, some could argue that it's better for them to be seen by that pediatrician, it's also an argument that, you know, the adult providers need that training. They need some of that familiarity. And I think that's the other issue. And we'll see more in our third survey with transportation, when we have folks going to other states and getting their care from other states, which I applaud, because I agree, you know, it's better to find the place that'll give you the best care. Absolutely, no argument there. But what the problem is then is that if all of our folks who have some of these developmental disabilities are going to other states to get their care, then our providers are not getting that training. They're not getting that experience as residents, as medical students, as early trainees to learn how best to deal with some of those scenarios, right? If everybody's going elsewhere, then where are we getting that training? Where are we getting that experience and familiarity with those situations? Again, you know, I understand why, but the how ends up being really problematic for a lot of folks.
That's a great point. Are we ready? Let's look at some of the write-ins, because I think what we mostly see is the word training, right? There needs to be more training. And what I saw when reading over these, especially for the first time, is you see a lot of hurt and angry parents who feel as if providers aren't listening to them, that they're not being trusted when they share, you know, what they're experiencing at home with their children. They're not feeling validated. You see a couple of parents who say things like, be your child's voice. If you don't agree with one doctor, get a second opinion with a different doctor at a different practice, which I completely advocate for. But it's so important that we remember that not all parents have the luxury of being able to do that, right? So I think that there's a lot of different kinds of trainings for a lot of different professions. And I think it's important for us to remember that some, you know, many of our children are seen by pediatricians in the state, but some are seen by general practitioners, especially in our more rural areas. Some are being seen by physician assistants and nurse practitioners, especially like in our school-based health centers. And so it's a lot of training that needs to happen across different staff, different disciplines, to ensure that kids are and families are being treated with respect, and that they get the resources they need to ensure they keep going back and accessing healthcare when needed. Anything else in these write-ins responses that stuck out to you all?
I think what stuck out to me, aside what has already been said, is that people are advocating for themselves. I think we have a hard time sticking up for ourselves. And I was actually surprised that so many folks said that they have switched doctors because they didn't feel like they were being heard. And so I think that that's great, because I spent over 15 years advocating for clients because they couldn't for themselves. And so I love that people aren't afraid to say, you know what, I'm not getting what I need here, and so I'm going to go somewhere else. And if that happens enough times, sometimes that forces people to listen and say, okay, I've had 10 people leave my practice. What is wrong? That would be the proper thing to do, is to evaluate what's happening. What do I need to do differently? So I think that it is great that folks aren't afraid to do that. And I hope that that helps with others, experience an eye-opening experience for others, so that they're more willing to see what changes they need to make, either for themselves or within their practices.
And that brings up a point I always feel obligated to make doing the job that I do, which is these kids here are lucky to have these parents who are advocating for them. When I read this, I also have to read between the lines of the parents who are unable to do that because maybe they have their own disabilities, or maybe they rely on people to help. And then the overwhelming number of children in state care who have nobody to advocate for them. What kind of treatment are they receiving? There's nobody there to watch out for them. And I think when we talk about all those things, we constantly have to keep those children in mind, because their voices cannot be heard in surveys like this. And there's nobody there to advocate for them at the doctor's level.
Really important point. Thanks, Shawna.
I think one of the comments that really stuck out to me is where it says, we can learn a lot from children's hospitals in Cincinnati, Ohio. So I'm from Cincinnati, and I was a Cincinnati Children's patient my whole life. And the reason that Cincinnati Children's is as prestigious and great as it is, all of their doctors are required to do research while they're actively treating patients. As long as they stay on the staff as someone that treats a patient, they have to be doing research with their field at the same time with the other doctors that work at Cincinnati Children's. And it makes me wonder, why is that not a norm? That research is how we improve our healthcare. Research is how we make an environment better for our patients. And I think a lot can be said from that comment, looking at, is it because Cincinnati's a bigger city than some of the counties in West Virginia? Does it come down to resources, or just a culture that's kind of stuck in one behavior and not able to pivot and change to the way that bigger progressive hospitals are treating their patients? And it's insane. There are so many patients at Cincinnati Children's that don't even remotely live in Ohio. So many people travel to those big hospitals to get the best care that they can, but they could get better care if we looked at that and kind of brought it to each of the smaller hospitals to better improve the care in each community so that they wouldn't have to travel quite as much.
Great point, Elliana. Thank you. Anybody else have anything on this survey? It was an eye-opener for me. I felt like we received responses that seemed like a cry for help, and so the most we can do at this moment is just try to articulate and uplift what we did here, and see if we can get some traction with those in the healthcare system who are willing to make a difference. So let me close it out and just quickly look and see if we have any responses or any questions. We don't. So I'm going to move on to survey number 3. We had a little bit of trouble with survey number 3. How do I say this? We had trouble because we weren't getting responses, which I think one reason was because people didn't realize that these were responses in a series. And so people who took surveys 1 or 2 thought that they had already responded. Secondly, we had put on social media that we would be giving out $25 gift cards to some random participants. And suddenly we got this influx of responses, which really heartened me until I saw some of the responses and realized that they were not of actual families in West Virginia. And so we had to delete some of them. So long story short, we only received 73 respondents for survey number 3. So this survey really focused on travel and accessibility, which is a prevailing theme that we heard in the first 2 surveys. So the questions that we asked were, of course, what county do you live in? How far do you currently travel to access primary health care for your child? How far do you currently travel to access mental health care for your child? How far do you travel to access oral health care? How far do you currently travel to access specialty health care for your child? Is it difficult for you to travel to visit your children's doctor or medical providers? If so, please explain. How far have you had to travel to access health care for your child? Have you ever used public transportation, including taxis, Uber services, etc., to take your child to a medical appointment? Have you ever experienced any of these challenges and some specific challenges? And again, these were things that we heard anecdotally for some of the families that we were working with, which we'll discuss in a minute. Have you ever lived outside of West Virginia? How does the state compare to other areas you have lived? What is the biggest transportation-related issue you've experienced when accessing healthcare? If you have ever lived in another state, please share details about the state and services. Have you ever moved in-state or out-of-state for better access to healthcare services for your children with developmental disabilities? Do you have any additional information you'd like to share about your experiences? Do you have a recommendation as to how better address transportation issues to ensure children with developmental disability have access to healthcare? Then we asked, what is your race and ethnicity? And in hindsight, I wish we would have asked these questions on the first two surveys, but we also heard from some people who were really hesitant to respond to that question. I'm not exactly sure why, but they wanted to know kind of the pertinence or the meaning for us asking, which we wanted to again look at disparities, right? So were people of different races or ethnicity having more pronounced problems than others? So anybody have anything they want to say about the questions before we look at some responses? Okay, let's pull it up. So again, we did receive a rather robust representation of counties from around the state. We heard mostly from people who identified as white, Black or African American, Asian, Hispanic, Middle Eastern, multiracial, and a few Native American folks. So how far do you currently travel to access primary health care for your child? So you see 41% said our child's primary healthcare provider is in close proximity to where we live. That's 41%, which is pretty good. That's 30 responses. Less than 100 miles was 24%, 100 to 150 miles was 4%, around 150 to 200 miles, 13%, as well as around 200 miles or over, which is pretty far to travel. For mental health care, you see it was a very mixed bag. So 19.18% said the mental health care provider was close to where they live. 15% said our child does not have a mental health care provider. Nearly 11% travel over 200 miles. 23.29%, 150 to 200 miles. 7 around 100 to 150. How far do you currently travel to access oral health care? The largest group said it's again in close proximity. That's 26 people. 20 people said less than 100 miles. And we had a couple that said around 200 miles or over. And then we had nearly 10% that said our child doesn't have an oral health care provider. Specialty care was again a mixed bag, which the largest is around 150 to 200 miles. So of course that is the one that had the most travel to access specialty care of all the different health cares that we asked. How far have you had to travel? 27% have traveled out of state many times to access health care. Have you ever used public transportation? 26.47% once my child was too old to carry, I could no longer access public transportation, which we knew going in that was probably going to be one of the higher percentages. If you had lived outside of West Virginia, how does your state compare? The largest, 46.15%, said I've previously lived in another state where healthcare services were more readily available in my community, as opposed to 29% that said fewer healthcare services were available. And then have you ever moved in state or out of state? 52% said that they have moved to access better health care, which is, I thought, was rather large. What were your thoughts on these responses?
I personally wasn't surprised at the responses because I think my bias was assuming that people were traveling a pretty great distance to get the care that they needed, especially from specialists and especially going out of state. I know from personal experience, my family actually moved out of state about 2 years ago for the sole reason of finding better care for my brother in another state with more services at a closer distance. And I think that's really unfortunate. And especially if you look here in the comments that people are recognizing that it's not something that they can do forever. It's not something that's feasible for many families. Gas is expensive, travel is expensive. It becomes very difficult as kids age and they get harder to transport. All of those things become very difficult. And as I mentioned earlier, it even robs our state of some of the training that it could get by taking care of some of these kiddos. So I think overall, it shows us that we do have a pretty significant problem.
We do. I'm looking at Amanda right now because I know Amanda lives in Ohio, and she and I have had discussions before about the differences in services once you leave the state. And so, you know, if you're living in a community where you are, you know, connected to another state with services, you're fortunate, but you also may be out of network, right, Amanda? And that becomes a real issue.
Yes. So I have lived in Ohio my entire life, but I've always worked in West Virginia, minus my teenage years. So I'm most familiar with West Virginia services, but I have had a very close friend who has moved out of state for her son for services because she wasn't able to receive those in West Virginia. I am unique in the fact that I live in the Northern Panhandle. So I have Ohio, West Virginia, and Pennsylvania right here. And many folks may travel to WVU in Morgantown, or they may cross over into Ohio to go to Columbus or Cleveland, or they're going to Pittsburgh. So here it's a little bit easier, but still many, many miles and lots of traveling to get to services. But we also have that situation where we're rural, but yet we also have Wheeling in the Northern Panhandle, which has public transportation. One other town in the Northern Panhandle has public transportation, the rest do not. So folks rely on whether it's motive care or themselves to have that transportation to get to services. They may live, pretty far from where others are, and they're unable to do it. They may not have their own transportation. Sometimes motive care isn't reliable. And so there's been a lot of issues with that. So I wasn't surprised that people travel far for their services. I think that we are lucky here in the Northern Panhandle compared to elsewhere, but I don't think that it's even just to this population, because I actually was speaking with someone this past weekend who has an issue and lives in Charleston and can't get the service in Charleston and has to travel elsewhere in the state. So I think that it's a broader issue. And I was actually very surprised by that. I was like, how could Charleston not have the service? So I think that I'm used to Ohio so much that I forget that Charleston is still pretty small compared to even like Columbus in Ohio, where we could get pretty much anything. We have Children's Hospital, we have OSU Hospital. And so I wasn't surprised by that at all.
Thanks, Amanda. We are a little pressed for time, and I want to make sure we give Elliana a little bit of time to talk about what she's working on if you want to learn more about the project. So the floor is yours.
All right. So we have been trying to figure out like what are our next steps in like engaging more families and being able to reach out to more people. Well, it's no surprise that almost everyone has access to some form of technology. We live in a world where we see everyone with cell phones in their hand on a day-to-day basis, whether it's something that they pay for or just something that is used bare minimum. So we have kind of wanted to branch out into using things like Facebook and Instagram, utilizing social media to try and connect with people on a more informal basis. I think sometimes just using surveys and like emails and stuff like that can be kind of scary to people. And also sometimes, I mean, personally, if I get an email, I don't always know if I'm supposed to respond to it. So we are using Facebook as kind of a way to reach out to the different communities in West Virginia, kind of like, hey, this is what we have going on. This is what we're noticing in this community and that community. And also what can we do? Like, what can we do to help you guys, especially the people experiencing the things that we're looking into? So, and also a lot of people, especially in more rural states like West Virginia, don't always understand like extensive medical jargon or like big terminology like, okay, so what does this organization actually mean? Like, what are they trying to accomplish? So I'm going to share my screen here. I've been working on creating a pamphlet that's very like people friendly to anyone with different grade level reading education and everything like that, just so that everyone that we could possibly come into contact with can understand what we are trying to accomplish. So let me see. It's not looking like it's letting me share.
You should be able to share.
Yeah, I'm trying.
She's looking. Let me just check one more time. We don't have any questions or comments. There we go.
Okay. Let's see. So this is a flat out version of what the pamphlet would look like. So this, where my cursor is, would be the front page. And so we tried to use colors of our logo and things that are researched that are very easy for people's minds to understand and kind of draw them in. So I wanted to start with it just explaining what we do. So what does including all kids mean? It means that every child deserves equitable access to health services. And
Eliana, could I stop you for just a moment? Do you all see anything that says, we're not seeing an image. It just says has started screen sharing, but it's not.
And I have YouTube up just to see what's going on. It's just black on YouTube right now.
Okay, let me see. So it looks like it's shared on my end.
How about you tell us a little more, and then we'll put it up online and share links in the comments because we've gone a little bit over.
Okay, let me see if I can stop sharing. Okay, so basically I took different data from the surveys and broke it up into different parts of a pamphlet to kind of showcase the different aspects of what we're focusing on, like the perception of healthcare and how we are treating people with developmental disabilities, the access to the healthcare and the issues with transport. And I broke it down to basically explain that our goal is that with the help of the people that live in West Virginia to improve our healthcare system for kids with developmental disabilities. And I used graphics and different images to kind of just show that on a like smaller scale so that it's easy for everyone to understand.
She also did a great video we're going to share more widely, just explaining the project. And how about we wrap up now? So we'll make sure and get that information out, because one of the things that we really want folks to do who have watched, if you were one of these parents or caregivers, we want you to participate in these surveys. We want you to reach out and join our email list, get on board and help us really articulate the challenges and recommendations for improving the healthcare system for your children and adolescents with developmental disabilities. And so with that, I really want to thank the data team, not just for joining us today, but all the work that you've put in over the past year. I agree that I feel like we've done good work. The surveys are great, and I look forward to getting more of them out there. If anyone watching has any additional questions or comments, they're welcome to continue posting in the comments section. We'll make sure and respond there. But if you'd like to join the project, you can email me at kelly@thinkkidswv.org or message us on any of our social media sites, and we'll get you connected. Again, thanks to everyone who's watched, our panelists, and I hope everyone has a great day.